You're bent forward, walking with support, living in fear that surgery is the only way out of spinal stenosis. But here's the truth. What if I told you the real problem isn't your pain, it's the pressure on your spinal nerve, and everything you've tried so far is actually making it worse? In this video, I'll show you a new non-surgical treatment with over 90% success, available in only 12 clinics worldwide, including ours in Ottawa, Ontario, Canada. It's changing lives, saving spines, and helping people walk again without surgery. And what makes it different is a breakthrough combination, two proven technologies working together in a way no other treatment does. I'll show you exactly how it works and why it's getting results where everything else has failed. I'm Dr. John Zlonka, a neurofunctional chiropractor in Ottawa, Ontario, Canada, and past director of rehabilitation at the Ottawa Sports Science Centre. If you have spinal stenosis in your lower back, this might be the most important video you ever watch, especially if you're trying to avoid surgery. Here's why. One major study found that 33% of patients who had surgery for lumbar spinal stenosis reported that it failed within just 1 year. So that means for every 2 successes, there was 1 failure. And it gets worse. Another long-term study showed that almost 1 in 4 patients needed another surgery within 5 years. Even more concerning, those who needed repeat spinal surgery ended up with more leg pain and more disability than the patients who never went back under the knife. So if you're scared of surgery, you have every reason to be. But here's the good news. There is another way to relieve that nerve pressure without surgery, without drugs, and without the constant cycle of stretching, resting, and hoping it gets better. That's exactly what we do with a breakthrough approach called non-surgical robotic laser spinal decompression. And no, this isn't your typical decompression table. This is the only system in the world that combines precise spinal decompression and advanced class 4 therapy at the exact same time. Why does that matter? Because while the decompression gently creates space between the vertebrae to reduce pressure on the spinal nerves, the laser goes to work reducing inflammation, relaxing muscles, stimulating heal, and accelerating nerve recovery right at the source of the problem. Now, I'm going to break down exactly how each part of this treatment works, why it's uniquely effective for spinal stenosis, and how it's helping over 90% of our patients avoid surgery and get their lives back. To understand why this treatment works so well, you first need to understand what's really causing the symptoms of lumbar spinal stenosis. It comes down to what we call the degenerative triad. These are 3 structural changes that work together to narrow the spinal canal and put pressure on your spinal nerves. So number 1 is what we call degenerative disc disease. So what we do want to see is we want to see vertebrae and discs that look like this. We want to see a vertebrae, we want to see a nice thick disc, we want to see another vertebrae. The thicker the disc, the more room for the nerves to actually come out. So as discs thin and collapse, what happens is the space between those vertebrae shrinks, which tightens that same spinal canal. So when we're talking about the spinal canal, we look at the vertebrae this way, but if we turn it this way, that's the spinal cord and it runs through the canal in there as well. So if you're getting that degenerative disc disease, the discs thin, they collapse, the space between the vertebrae shrinks, that's going to tighten that spinal canal. Number 2 is what we call facet joint hypertrophy. So the facet joints are the joints you're going to see in the back here, okay? And the facet joints are actually where the vertebrae meet at what we call the facet joints. So hypertrophy means that you're actually getting almost an overgrowth, so to speak. Over time, the small joints at the back of the spine become arthritic and enlarged. This overgrowth pushes into that same canal and again reduces space for the nerves. And then number 3, you're going to get what we call ligamentum flavum thickening. So this key spinal ligament can thicken and bulge inward due to the repetitive stress, to misaligned vertebrae, or degenerative arthritis, further narrowing the canal. All 3 of these will cause degeneration that will put pressure on the spinal canal and thus put pressure on the spinal cord. In addition to the degenerative triad, there's still 2 more things that lead to stenosis. Number 1, if there's what we call a disc bulge or herniation, so if you can see this, the disc is actually bulging back outwards onto not only that nerve, but it can bulge into the canal itself. So it can further narrow the spinal canal, reducing the space available for your spinal cord and the nerve roots. And number 2, there's also, which is often missed, what we call spondylolisthesis. So a big fancy word, but it means that the vertebrae have literally shifted one on top of another. Okay? And when that happens, impossible not just to be putting pressure on the nerve that exits there, but you're also going to tense the spinal cord that's inside there as well. These combined changes often lead to symptoms like back pain, leg pain, numbness, weakness, and even difficulty standing or walking. So what does this mean for treatment? Well, to actually get relief, you have to do more than just treat the pain. You have to create more space inside that spinal canal. You need to calm the inflammation. You need to retrain how the spine moves, especially during daily activities. And that's exactly what non-surgical robotic laser spinal decompression is designed to do. Let's start with spinal decompression. So before you ever begin a session of non-surgical robotic laser spinal decompression, I want you to clearly understand how this technology works and why this combination is producing such life-changing results. This isn't just another decompression table. It's a precisely engineered, computer-controlled system designed to gently and safely create space between the vertebrae, targeting the exact spinal segments that are affected by the stenosis or the disc issues. By slowly stretching and releasing the spine in cycles, the decompression system reduces internal disc pressure, it pulls bulging disc material away from the nerves, and it relieves mechanical compression from the degenerative changes that I mentioned earlier. This directly addresses two parts of that degenerative triad. It helps restore lost space from disc thinning, and it creates more room despite joint overgrowth and ligament thickening. That's why many patients feel leg pain relief even during their first sessions. Now let's talk about how decompression relates to movement. It happens in a flexion-based position, slightly bending the spine forward because this posture naturally opens up the spinal canal. This mirrors how many stenosis patients instinctively lean forward to get relief. Think of all those people you see in the grocery store leaning forward on their shopping carts. They're opening up the spine. So we're not just decompressing the spine, we're encouraging healthier, pain-free movement patterns that carry over into daily life. And for patients with disc herniations, decompression helps even further. It creates that gentle vacuum effect through the creation of negative pressure in the disc. So that's important. Negative pressure, traction won't do this. Inversion tables can't do this. Only true spinal decompression can create negative pressure in the disc that can retract the disc. It reduces nerve irritation at the source. This is why spinal decompression, as we said, is so much better and different than that basic traction. Traction does not create negative pressure in the disc. Now let's talk about the second part of the treatment, class 4 cold laser therapy. While spinal decompression relieves the mechanical compression, cold laser therapy activates the body's natural healing response in the surrounding tissues. This low-level medical laser is completely painless and non-invasive, but it penetrates deep into the spine, stimulating cellular energy production and repair at the mitochondrial level. Here's how that ties into stenosis. Class 4 laser reduces inflammation around those compressed nerves, making them less irritated and more responsive to decompression. Class 4 laser helps calm the chemical messengers that amplify that pain, especially the deep aching sensations in the lower back and the legs. It also causes tight spinal muscles to relax, which is key. The more laser, the better the decompression. The better the decompression, the deeper the laser. They work hand in hand. Why is muscle relaxation so important? Because when your back muscles are guarding or bracing from chronic pain, they're going to resist decompression, making it harder to open the space in your spine. The laser helps those muscles relax in real time, making the decompression treatment more effective, more comfortable, and more precise. And again, if you're dealing with a disc herniation, laser therapy improves blood flow and supports faster healing of the disc tissue, stabilizing the injury and reducing the risk of future flare-ups. So to keep it simple, spinal decompression creates the space and relieves the mechanical pressure caused by that degenerative triad. Very simply, if you've got pressure on the disc, pressure on the nerve, and a dehydrated disc, we need to take the pressure off the disc, the pressure off the nerve, and rehydrate the disc. And cold laser therapy is going to calm the inflammation, plus relax the muscle and accelerate tissue healing right down to the cellular level. Together, these treatments relieve both back pain and leg pain at the root cause, and they help prevent it from coming back. That's why non-surgical robotic laser spinal decompression is so effective, and why we've seen over a 90% success rate with patients suffering from lumbar spinal stenosis, disc herniations, and other serious spinal conditions. And most importantly, it's helping people avoid surgery, stay active, and get their lives back. People like Jeremy, 29-year-old, who've been living with chronic serious back pain for years. He was actually ready to go spend $65,000 on surgery in Germany. Instead, he came to our center. Pre-MRI, you could actually see not only the spinal stenosis, but also multiple disc herniations. Post-MRI, you could actually see a reduction in both the spinal stenosis and a receding of the disc herniations as well. Jeremy's finally back to the life that he deserves. So when you combine spinal decompression with class 4 laser therapy simultaneously, that's right at the exact same time, you get something that no other treatment offers, a system that relieves pressure, reduces inflammation, relaxes protective muscle guarding, and stimulates healing at the cellular level, all happening at the same time and in each session. This is what makes non-surgical robotic laser spinal decompression so unique and why there are only 12 of these systems in the world. It's not just a decompression table, and it's not just laser. It's the only healthcare technology in the world that delivers both treatments at the same time with precision targeting in a robotic pattern in a posture that opens the spinal canal naturally. That's how we've been able to achieve over a 90% success rate in treating serious spinal conditions like spinal stenosis and disc herniations, even in patients who had already tried everything else. And most importantly, it's helped them avoid surgery, staying active, and getting their lives back. Right now, there are only 12 clinics in the entire world that offer this advanced non-surgical robotic laser spinal decompression treatment. If you're wondering whether it's available near you, leave a comment below. We'll help you find a clinic if we can. Our clinic is located in Ottawa, Ontario, and we've had people travel from across the province and even out of the country just to receive this care. If you're dealing with spinal stenosis or disc herniation or degenerative disc disease and nothing has worked, this could be the solution that you're searching for. If you're suffering with spinal stenosis and this video gave you even a glimmer of hope, let me know in the comments below. I read every one of them. Also, like and share this video so more people can discover a path to relief without surgery. My mission is simple: to introduce non-surgical robotic laser spinal decompression to as many people as possible so they too can avoid surgery and regain their lives. Make sure to subscribe if you want to learn more about this breakthrough treatment, and if you're looking for proven tips and strategies to relieve back and neck pain without relying on drugs or surgery. And if you want to start getting relief right now from home while you search for a clinic near you, check out my video on spinal stenosis exercises. It walks you through simple at-home movements that are easy to do and specifically designed to take pressure off your spine. Please go watch this video next.